We are here today talking about this Learning Health System Action Framework, and we've actually been on a series here. This is the fourth in the series. The first one, led by John Lavis, Maureen Smith, and Rob Reed, talked us through this entire framework and how it applies. And it was really a great opportunity back in April. I encourage, if you didn't see it, that you go back to that original one to get a sense of the entire framework and how it fits and how it can support change and improvements in the health system. Within there, we have these different gears. So the first one is around analytics and data, population health. We did that in May, had a number of OHTs presenting for that day. Then we did evidence synthesis in June. I encourage you to go back and look at that. And I see post-event, that's actually one of the highest viewed events so far. Over 350 have gone back to view that one. We had representatives from a number of Ontario evidence and synthesis shops. Today, we're in this central, and I think focal gear for patient caregiver and provider co-design. On the next slide, we talk about some of the details of this slide, of this gear, the Learning Gear 3. And this is where, we have it in the middle because I think it all comes together here. And it's essential in every element of the program, but particularly here in co-design. This is talking about direct engagement and co-design with patients, caregivers, and care providers, as well as broader community members impacted by the health problem that we've identified, alongside those who can actually move the design services towards successful implementation. So thinking about how do we think about co-design in a way that will help us in the next step, which is implementation. We want to co-design the things that fit and achieve the goals of patients, family, caregivers, and also are those things that help support providers, and providers can support this work. So some of the questions that you might be thinking about when you're doing this co-design work are: what are the user-centered conditions? What considerations are most important? How can technology be used? And how do requirements differ for equity-deserving groups? How do we engage and balance power? And what are the feasibility constraints about what we can actually do? So those kinds of questions we're really looking to delve into in this co-design work. Many different organizations, groups, affinities, meaning sort of where people are coming from around this space, from design experts to clinical programs, health informatics programs, patient, family, caregiver councils, community groups, health system leaders, providers, many people being involved in this co-design work. It's really quite important and essential.